I'll start off with a few words of introduction, then I'll request Dr. Srinath to make a few preliminary comments and introduce Dr. Henk Bekedam. Then we'll go ahead with the presentation. Friends, all of us around this table are the converted. I think there's not one person here who is not committed to a publicly funded quality healthcare accessible to most Indians, if not all Indians. But if we preach to the converted, that does not help. So this roundtable is a very focused and purposive one. This is not about expression of our angst or description of our conditions, except to the extent that that will facilitate development of a better model and our efforts to make that happen. We have three specific objectives today. One, to make a compelling economic argument backed by evidence for something approximating a universal healthcare. Not an emotional argument, not a moral argument. Not that they're not necessary, but we have to ultimately persuade the government and decision makers. And we perceive a sense of reluctance to look at a socialized medicine or universal healthcare unless there is a compelling economic logic. So that's why I'm deliberately setting the bar high. Otherwise, a moral argument is very clear. Emotional argument is very clear, but we have to make a compelling economic argument, a case that cannot be easily resisted. Two, to come up with, there are many experts here who worked for a long time in this sector. They come up with terrific models and insights over a period of time. Now is the time to synthesize. There's nothing very original, but we have to synthesize, and together we have to come up with some model which meets at least three standards. A, it is feasible. Politically, administratively, logistically feasible. B, it is effective in delivering the outcomes that we all seek. C, it is affordable to the country. Now, saying that UK spends 8% GDP, US spends 8% from public exchequer, some other country spends 5%, all this is nice, but that doesn't take us anywhere. We have a certain situation in India, therefore, unless it is feasible, effective, and affordable, given the specific Indian context with all our strengths and weaknesses, the model will go nowhere. Ultimately, we must achieve a realistic outcome. If we're aiming at 100 today, at least 70, 80 must be achievable in the next 1 or 2 years. And the policymakers and the political executive and the parties must come on board. And unless we work on that assumption, this will be a futile exercise. Therefore, it has to be a very focused thing. A certain model has been attempted on the basis of synthesis of all the existing literature and efforts and expert committee reports. This is not written in stone. There is no one model which really works everywhere. India is a diverse country, therefore all we can look at is some generic approach based on the available numbers. Even numbers are very confusing. There are all kinds of data problems in this country. We all recognize that. So we make some assumptions, we make some guesswork, we have some ballpark numbers, hoping that they're not too far wrong. Maybe 20, 30% wrong, but not wrong by an order of magnitude. But we have to come up with a model we all can broadly live with. And we'll keep on improvising the model. Even as the government starts implementing it, if they do implement it, I'm sure they'll find many more better approaches with more experts and more experienced practitioners coming to the fore. And C, we have to start a process of networking informally, create some kind of a universal healthcare network, and look at strategies systematically to try and make this happen. Once we broadly agree on a certain model, we have to make this happen, and therefore that effort is equally important. Therefore, these are the three specific outcomes we are seeking. Let me recap. One is to make a compelling economic case which cannot be resisted by any reasonable organ of state or a functionary in government or political parties, and also that appeals to the country at large. And to come up with a viable, with a feasible, with an effective and affordable model, and to have some kind of an action plan about and a strategy to make this happen by pursuing the matter. Already we have a meeting scheduled on the 25th, day after tomorrow, with the Niti Aayog. They asked for a presentation on this. It's good that they asked it on 25th, so that we take the feedback of this team today and incorporate that. As I said, nothing is written in stone, but that's the first step. But that's a very small first step. There's a lot more to happen. And we really have to together pursue this. We're already very late as a country. We all know that. And at least now in the next few years, if we make this happen, this will be one of the greatest accomplishments in independent India. I'm particularly grateful to all of you. In summertime, at enormous personal privation, people have taken the time off on a Saturday to be here for a whole day, and that means a lot. And I'm sure more people, more people will join. And I'm particularly thankful to both Shiva and Praveen for that enormous time, energy, and sacrifice. Now on to Dr. Srikanth.
Thank you very much, Dr. Jayaprakash Narayan. Basically, as Dr. Narayan has said, there is an opportunity now to try and provide some inputs to policy through a wider public discourse, which can provide information as well as attempt to influence that policy. We have the legacy of multiple systems that were not created by design but emerged by default in a mixed health system. And we now need to deal with that legacy in order to try and remedy the situation in terms of fixing some of the faults and trying to create a new structure without necessarily having to dismantle everything, because that's not really possible. And how do we do that best in a framework of universal coverage which provides assured access and affordability to all, with a particular emphasis on ensuring financial protection for the poor and the near poor and the middle class as well. And also in a situation where the federal system as well as the ground realities will demand state-specific contextual modifications, how do we still retain the element of portability of a system across the country? These are going to be some of the challenges. But a wider public debate is important. Almost as Dr. Jayaprakash Narayan said, almost everybody is agreed that universal health coverage is a good idea, whose time has come, not merely because it's part of the SDGs, but because it is a compelling need for India. But the roads to universal health coverage are fiercely debated. Many people have different ideas, different models, and even what is meant by universal health coverage is also debated by different people who attribute different definitions to it. But it's important that we get some clarity, and the only way we can get some clarity and if, later on consensus is by wider public debate, and where different opinions can actually be aired, and later on we may be able to get some convergence and consensus. And that's why I think this particular consultation is of great value in providing the platform for that kind of debate. And for chairing the first session, we have Dr.Henk Bekedam, who is the WHO representative to India. Dr. Bekedam is ideally placed, not merely because he represents WHO, but because in his own professional experience, he was in China at the time as country representative at a time when the Chinese health reforms were being actually framed, and influenced some of that process through his own contributions. He also served at the Western Pacific office of WHO, where he was a fairly engaged witness to the changes that were taking place in terms of universal health coverage and health reforms in countries like Vietnam and South Korea. And then he also served in Egypt as country representative, and he has come here. And since Dr. Jayaprakash Narayan has very clearly emphasized as the number one priority of this consultation is to make an economic case, in his academic background too, Dr. Bekedam combines his medical training with training in economics. So I think there is no better person from point of view of his experience as well as his overall expertise to chair the opening session. Over to you, Dr. Bekedam.
One logistical issue. Each of you is given the schedule today and also issues to be resolved. This is not exhaustive or comprehensive, but a general outline so that we actually focus. In each session, we expect to try and see how many of these things can be covered. The first session has no issues, the overall presentation, but the next one onwards, the primary and family health care, we'll take up each segment of this. The idea is that we will, as far as practicable, come up with some coherent answers. Some of the questions have immediate answers, some may have some, there will be some diversity of opinion. But my request is, let us try and get answers to these and other possible questions so that the model can be made bulletproof. That's a specific question. Dr. Bekedam.
Yeah, thank you very much, and thank you also for your kind introduction. But good morning, everybody. It's really a pleasure to be here, and I think with the emphasis on the consultation part, I think I can't agree more from how important it is that we discuss these matters. I'm 5 months old in the country, still learning. But for sure, one of the things that has been lacking so far, in my view, and I think I have expressed myself sometimes in meetings like this and sometimes in opinion pieces and the like, is indeed to think about from where India should be in 2030. A vision from how the system should start looking like. And especially in a country like India, accepting that states have the main responsibility in health, if you do not have an idea from where you're all going, it becomes chaos. So in that sense, to have a discussion over here, to have a sense of direction, say from this is the direction that we need to be going, it's very important. I will even share with you something, but you should promise me not to say it to anybody else. When I started some of my first discussion with senior government officials, when I was trying to have a debate about the vision, many of them said, I don't have that time frame. My time frame is 2 to 5 years maximum. And then I said, look, but if you have something like the health sector, which is very complex, there is no way that you can achieve things within 2 or 5 years. Of course, you can achieve things, but if the bigger picture is far beyond 2 or 5 years. But I have also to give some credit from in the whole process. What happened is then 2 months later, when I started discussing with the same official, actually he called me. I'm already revealing the gender, but here you are. And then what happened is the Prime Minister's office started asking questions from, guys, where are you going? Where does it all end up? What would you now like to do from you doing this, but how does it relate to other issues, etc.? And I was very encouraged by this. And I think we shared also with Srinath, we had also some discussions about this, and we felt from, look, I think there is now, it's the right time to start discussing about where to go. It is true from that in this whole process, and as a chair, of course, I need to be careful. I need to be facilitating only. You might not expect me to say a lot of issues already before anybody start talking. I think in some of the issues that you raised, the 3 issues, I think on some issues will be very clearly. The economic argument, I think it will be something but just collecting things, and many have made the arguments, and that is not only about India, that's in any country. Investing in health is investing in wealth. But again, let's not go into details on this one. The arguments will come. But I think it's also true from having worked in several countries. There's one thing what I do know, is that you need to start from where you are. You cannot start jumping over the realities in a country. And I think that is an issue which is very important. But not only about realities, it's also about people. If people came up with initiatives, they might not be perfect, but you better start working with it, because these are the people who will be taking the matter forward. Ignoring from what has already been done, ignoring that many things start also from a good heart, and coming up with something completely new, we need to be careful. So, but having said so, that should not stop us thinking from what we need to be aiming for. I think these are 2 different issues. I'm also a strong believer from, and that's in my work indeed, I think, Srinath, thank you also referring to this, from both in China, but I worked also with 37 other countries. And we had always 2 issues. One, we said you need to have a vision where you would like to go, and then you start defining what you're going to do the next 3 to 5 years. Because even when your vision is very clear and everybody agrees, nobody can make that big step at once. You will fall and things will go bad. But then you need to start defining from, well, you know where your journey is going, that you need to start defining how your first step should look like, and also be very accountable on this. But let me not say too much as a chair at this very moment, but I'm very much looking forward for the discussion, and now I most likely have to hand over to the people who are going to present. And then once again, thank you so much coming so far from the NHS. Is also close to my heart. My wife is British. I have studied also in the London School of Economics, and for sure the NHS was a very special baby. But very much looking forward to here.
Everybody has this booklet. If you don't have copies readily available or you need them, they'll be circulated. But this is somewhat dated already. While we have printed it and all that, this booklet we have sent it. Both email and the hard copy was sent. Hard copy also. But no, they'll will somebody make sure that those who need them have copies. But this is already dated. While much of it is the same, but the structure is changed to suit the presentation to government in the light of what I myself admonished myself. And also some of the numbers, even in the last 15-20 minutes, we changed some of the numbers. Everything is ballpark, therefore these numbers keep changing, but we are trying to get the best estimate or guesstimate at a point of time. The actual modal part, I would request our friends Shiva and Praveen to talk about that. Meanwhile, I'll take you through some of the slides. But Shiva, as far as practicable, I would request you to stick to this because the numbers are based on this. Then you come with the details. Okay, I leave it to you in whatever manner you feel comfortable.